CDC estimates we spend $34 billion a year on vitamins, supplements, and alternative therapies. Now, a new book is called Do You Believe in Magic? It debunks treatments that it says does not work. It's written by Dr. Paul Offit of the Children's Hospital of Philadelphia. Good morning to you, Dr. Offit.
Good morning, Gail.
You say there's no such thing as alternative medicine. Either the medicine works or the medicine doesn't.
Right. If an alternative medicine works, it's called medicine. If an alternative medicine doesn't work, it's not an alternative.
And in your book, you're taking on vitamins, megavitamins specifically.
Right.
Because why?
Because although I think multivitamins don't hurt you, I think most people don't need them. But when you take large quantities of vitamins, 5-fold, 10-fold greater than the recommended daily allowance, I think the data are pretty clear at this point that you increase your risk of heart disease, increase your risk of cancer, and shorten your life. I think people have this notion that vitamins can never hurt you. There's even one commercial, actually, where they have a woman sort of taking a small preparation of vitamin C and saying you would have to drink 2 gallons of orange juice to get as much vitamin C as in this. Maybe you're not supposed to drink 2 gallons of orange juice.
But is your argument it's okay to take vitamins, don't take too many?
That's right.
Okay. Let's talk about alternative medicine because, as Gail just pointed out, you say there are 2 kinds of medicine. There are a lot of people who use acupuncture, for instance, who say it actually helped me. You say there's no proof that it helps?
No, I think acupuncture actually does help some people. It just has nothing to do with putting the needles under the skin. I think what we've now learned is that you can use retractable needles, and that I think some people do learn to release their own endorphins, which are these pain relieving medicines that our own body makes. And that's great. I think that's great. But it's not, there's nothing accurate about acupuncture. You actually don't have to put the needles under your skin, which makes sense. I mean, the ancient Chinese didn't know anything about human anatomy.
Are there supplements worth taking, in your opinion?
I think there are 4. Certainly folic acid should be taken by women of childbearing age to avoid disorders in their children like spina bifida. That's clear. I think that vitamin D should be taken by babies whose mothers are exclusively breastfeeding them and don't get outside much. Then there's sort of the softer ones, omega-3 fatty acids. The data really aren't clear that it prevents heart disease. And then the big ones, I think, are vitamin D and calcium to prevent sort of thinning of the bones. And there the data are on both sides. It's hard to be clear
I
about.
talked to David Kelly, who was a friend of Steve Jobs, for 60 Minutes, and David had cancer as well. And Steve talked to him and said, go get good medicine right away, was what the lesson was. You believe what about Steve Jobs?
Steve Jobs had pancreatic cancer, and I think when people think of pancreatic cancer, they think it's a death sentence. But that wasn't his tumor. He actually had a so-called neuroendocrine tumor of his pancreas, which would have been virtually completely treatable with early surgery. But he waited. Instead, he got acupuncture, he got bowel cleanses, because he thought this was an all-natural thing to do, and it ultimately cost him his life.
But with respect to you, sir, isn't it dangerous to say if you never treated a person what might or might not have been the consequence of his disease?
I'm sorry, I don't understand. You mean,
in other words, did you treat Steve Jobs?
Oh, no, I didn't.
I'm saying, isn't it dangerous to suggest what he might have been able to do if you didn't treat him with respect to his survivability and that kind of thing? Sure,
fair question. I think what you do know about Steve Jobs is you know he had a neuroendocrine tumor. You know that neuroendocrine tumors have a 95% chance of survival with early surgery. You know those 2 things. You also know that he significantly delayed his surgery. So you know those 3 things. I think that adds up to the fact that he put himself at unnecessary risk by choosing an alternative course.
So for Steve Jobs or anybody else, the most important thing to do if you have cancer is go immediately to
someone who has an expertise and experience in treating the disease and not try and treat yourself off the internet.
Fair enough.
All right, Dr. Paul Offit, the name of the book is Do You Believe in Magic? The Sense and Nonsense of Alternative Medicine, because it was very fascinating to me. I learned a lot, especially the menopause section.